Good afternoon and welcome to HealthLeaders, the Winning Edge program, a weekly series of webinars touching on the topics and strategies that you need to know most. My name is Eric Wicklund. I'm the Senior Editor for Innovation Technology here at HealthLeaders, and I'm going to be the moderator for today's session. Today's webinar is titled The Winning Edge for Revolutionizing Revenue Cycle Management with AI, and this is sponsored by FinThrive. Thank you to our sponsor for making today's program possible, and thank you to those in the audience for participating. Before we get started, we've got a few housekeeping details to go over. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleaders.com, healthleadersmedia.com, sorry. To ensure that you can see all the content for this event, please maximize your event window and be sure to adjust your computer volume settings and or PC speakers for optimal sound quality. Next, you'll find a resources list for today's webinar. It's in the upper right corner of your screen. Here we've listed the webinar slide deck and some additional materials for you to download, along with a registration link for future The Winning Edge events. And again, these events are held every week. At the bottom of your console, you're going to see some multiple widgets that you can use to submit a question. And we will have a Q&A session to this webinar. It comes at the tail end of the hour. Please click on that Q&A widget. It may be open already and appear on the left side of your screen. You can submit questions at any time during this presentation. However, please note that they'll be answered during that Q&A session. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which is a question mark icon and covers common technical issues. Now, at this time, it's my pleasure to introduce our panelists for today's discussion. Due to technical issues, we have one panelist who hasn't yet joined us. We're hoping he will join us soon. I do have Steve Rinaldi, Senior VP and Chief Revenue Officer of UNC Health. Thank you, Steve. And John Landy, Chief Technology Officer of FinThrive. And again, Clark Casarella, Lead Data Scientist of Stanford Health, hopefully will be with us shortly. Thank you all for joining us today. And let's get into the discussion. A very easy first question. Could you tell us a little bit about yourself and organization? And Steve, as we get into this, tell us a little bit about how you are using AI in the rev cycle area. So I'm going to start with you, Steve.
Oh, thanks. Well, good afternoon, everyone, and thanks so much for having me. My name is Steve Rinaldi, and I'm with UNC Health. A little bit about UNC Health, which is centered in Chapel Hill, North Carolina. We are a $10 billion healthcare system serving the state of North Carolina. What we like to say, from the mountains to the coast. An academic healthcare system, which is rich in research and quaternary care. We have over 3,000 employed physicians, more than 2,500 affiliated providers, over 16 hospitals. I serve as the Chief Revenue Officer and have for the last several years here, bringing over 30 years of strategic and operational financial leadership. I've served various roles in the healthcare system, and prior to joining UNC as Chief Financial Officer and previously as Chief Auditor. I'm an accountant by trade, so looking forward to the details and to the discussions today in the conversation.
Thank you. Okay. John.
Yeah, thanks, Eric. John Landy. I'm the Chief Technology Officer here at FinThrive. FinThrive is an RCM technology company. We're a SaaS platform that really focuses on increasing revenue, reducing costs, and also improving financial performance of healthcare providers in the market today. Recently, we've really been focused on AI, and of course, we're always targeting automation, analytics, and processing of large data. With our large portfolio of products, we focus on the full revenue cycle from the front office with virtual intake all the way through the back office operations. And we're looking forward to chatting today about AI and automation. So thanks for having me here.
Certainly. Okay. Now, certainly AI is all the talk these days. We just came through a program called a mastermind on rev cycle technology, where AI was pretty much the subject of discussion throughout the entire program. Now, it's been said that AI, and we're talking about augmented intelligence here, not artificial intelligence, could could change. Let's go with easier words right now. Could change how RCM operations are handled. Certainly helping with administrative tasks and so on and so forth. Steve, could you tell us a little bit about how you're using AI now in revenue cycle operations? What are the pain points that it has solved, and how are you measuring the success of these tools?
Sure, I'd be happy to. Excited to share our journey. I think it begins with us needing to define what revenue cycle is. UNC, from our model perspective, we break it down similar to what John was alluding to in a front, middle, back perspective, with the front end beginning with scheduling, whether that's through referral or placement of existing patients. And so starting right at that front end, we're leveraging AI for referral and appointment matching, which I think is critical. If you think about how a referral is made, it's often because you've seen a primary care doctor or another provider who's determined that a specialty service or something else is needed. And their referrals are based upon their biases, or perhaps even referring you to someone that they know. But this is a great space for augmented intelligence and what I would call agentic AI solutions to lean in and match that referral with an actual provider who can provide the service that they need. Not all surgeons provide all surgeries, and so on and so forth. So that's where we're starting the process. From there, we lean in with a number of technologies across our front, middle cycle, and back, beginning with eligibility verification and insurance discovery, which is one of our solutions that we have in partnership with FinThrive, which we're experiencing great success with. As we move through that process, there's a number of opportunities that we have to tackle some of those pain points. One of them is in the authorization space, another area that we're using automation. It gets a little bit confusing, and be really interested in John's perspective on this as a CTO, but it gets very interesting from the perspective of how we define AI. I think that there's a lot of confusion about whether or not it's machine learning or robotic process automation or other cognitive thinking. So in this area, a lot of the work that's done in the authorization space feels more like RPA than it does machine learning. But where that leans in is in the opportunity to pick up patterns of denials and the information that our payers and others are looking for. As we move into that middle revenue cycle, and please tell me if you want me to continue going through that, or if you want me to pause. Yeah.
No, go ahead.
Sure. So in the middle revenue cycle, this is a great opportunity to leverage some other technologies. So ambient listening is one that we have in place in our physician suites, of course, with patient consent. That's a wonderful opportunity to get the provider away from the laptop and increasing that patient to provider connection that many felt was a little bit disconnected because of the need to be in the EMR and documenting during the visit. Using that ambient solution has been helpful to creating documentation, and I'm sure many of the attendees are probably using something similar. We then roll that documentation into the use of technology such as Evidently, that's helping us complete documentation, prompting us, and doing what we consider to be clinical decision support within the Epic platform that we're subscribed to and using. That's an ideal space then, right? Because from there, it flows into automation that we have in place with agentic solutions for coding. Right now, we're trying that primarily with simple visit coding through Epic and with an outside partner in terms of physician coding services. That's an area, to your question of how do we measure success. We need to be sure that these technologies are at least as accurate and successful as our expert coders. And what we're finding is that they are. And in many cases, they're much more accurate on the selection side than what we were seeing from our care providers at the bedside. And lastly, as we move into the back end, and I know and hope we'll drill into some of these a little deeper. We really have an opportunity to engage around the patient financial experience, primarily through the use of predictive analytics to leverage propensity to pay scoring, federal poverty level and income data that's necessary for compliance in North Carolina with medical debt forgiveness and presumptive financial assistance, and use that information to design solutions for patients to meet their liability associated with care in a way that is thoughtful and considers the many financial challenges that they face. Doing that in a sort of compassionate manner is really important to our mission, not just in serving the patients and residents of the communities in North Carolina, but making sure that we help connect them with their appropriate financial solutions for the cost of that care. So from an end-to-end basis, very, very connected and leveraging technology really in tech enablement in every opportunity that we can, whether it's through our partnership in insurance discovery with FinThrive or on the back end and some of the things that we're even developing ourselves in-house.
Okay, that was great, Steve. Thank you very much. You've raised some very good points here. One point I did want to make is that AI, automation, predictive analytics, they've been around a long time. Yeah, long before the whole AI hype rose. With this new wave of generative and agentic technology, I think this is where some of the newer things are coming out, and certainly we'll get to them. Now, John, tell us a little bit about the market as a whole. Is this what you're seeing of health systems? Are they following this similar path, or are there different ways of approaching the use of AI in revenue cycle?
Yeah, and thanks, Steve, for that overview. It's excellent background, and also exciting to hear what you're doing at UNC. I think just one point I wanted to say, what is, I guess that overall thing, what is AI and like what's included and what isn't. I guess it really doesn't matter as long as we're getting the desired outcome of kind of intelligent workflow, and to do that, really the way we look at it at FinThrive is that AI is this overall, artificial intelligence sort of landscape. And there is, machine learning has been really a big part of what we've been doing over a lot of years. We as like technologists have been doing, it used to be quite different, honestly. It used to be really go off into a lab and figure it out and try to figure out a model that works by analyzing data. And it would take a good amount of time to do this. We at FinThrive have been doing it for a number of years. We've had a dedicated team, but everybody in the industry has been working on machine learning for quite some time. That's been really part of it, really part of the technology scene for a while now. Deep learning is a subset of that, and deep learning really has Gen AI. And Gen AI is really what's changed now with LLMs really over the last 2 years, really 18 months, where we've got the processing power to be able to handle these large language models. So it's really exciting. And Gen AI is what everybody's using now, like personally, and really great first use kind of ROI when you're looking at generating content, inspecting content, and analyzing that. So that's part of it. And then we have natural language processing, which is basically, we've been doing OCR for a number of years. That's kind of overlapping this AI world, and it definitely in the AI world, we're seeing it to inspect like contracts between payers and providers, which is a really good use case for NLP. Can be reading OCR uses NLP to read like licenses when you check in, that kind of thing. So all of that's there. The point I was trying to get to is that RPA and traditional robotic processing automation is kind of outside of it. But with agentic AI, you could see now it's all kind of come under the same umbrella, because we have agentic AI, which real simply, I just kind of say it's intelligent workflow. and sort of driven by models from ML, AI. It's driven by NLP. It's driven by automations through RPA, because a lot of systems we interface with have to use RPA to actually do that. So that intelligent processing that we're now seeing with agentic AI is really great. And you could think about that kind of like taking the place of a human interaction, which is really great way to view RCM in general. So that just overview, I think what Steve was mentioning is really what we're seeing in general. Coding's a great use case. Ambient listening on clinical side has been, and when you go to an AI conference for technology vendors, that's the number one thing you see, across the board, and it's really going to change the patient experience. And then in RCM, we're saying, well, what are the biggest problems and where can we help? Number one, I mentioned really these payer-provider contracts and getting those processed and updated. We're really focusing on that from an agentic viewpoint. Contracts are semi-structured. Believe it or not, they are just like a document with a bunch of words in them, and you need to figure out how to make sense of that and put it into a structured format so you can use software to work on that. The other area is detecting prior auths. Prior auth is a big issue in the market. We're using machine learning and some agentic work, bundling that to be able to handle submissions for prior auth, but also detect, is it going to be needed, predict it, and then submit it, get a status on it, and then submit it, which we think is a great use case, and we're seeing a lot of interest in that in general. And then I'd say two other quick areas just to touch on is definitely with denials. So denials is, we all know the stats on denials and what we're seeing from increases from denials. So denials prediction, and then also having a view into denials and underpayments. Underpayments are a big problem that are lurking out there. So we've really focused on handling reporting around denials and underpayments, and that gives you payer trends and payer interesting things when you use AI to look at that you could actually really drive your business and give you some insight. And then the output of that is really around cash flow forecasting. Like, how can you look at 30, 60, 90 days for cash flow? It's a super difficult problem to solve for unless you have these intelligent underpinnings to know what payers are doing, what your typical flows are going to look like, and how that could go. And then last thing, just because Steve mentioned insurance discovery, it's a big database of coverage. How can you really rank things with payment likelihood? You'd never be able to do that by writing a query against a database. Like, you need AI to be able to help you to optimize, your best chance for success to recover or detect or identify insurance coverage for your patients. And we're really focused on that area. We think that's another good area to focus on, processing a lot of data across a lot of different payers and provider data, which we think is really interesting. So I think that's kind of what we're seeing out there. I mean, I think across the full RCM, suite, we're seeing people really talk to us about agentic for everything that kind of humans are doing today, only because we think we can make it more efficient, less error prone, and be able to scale, which is a big part of our problems, be able to get quicker resolution and faster time to recovery.
Yes. Okay, thank you, John. You gave us a good 4 to 5 key pain points that AI can address. And I'm going to go off script a little here and turn this question right back to you, Steve. What are these the same pain points you see AI addressing, or do you have certain priorities that you want to see AI address in RCM?
Yeah, I think there's a couple different areas. Piggybacking on some of the things that John mentioned, managed care is another area that falls under my responsibility for the system, and the payer variance work and the contract terms and conditions elements, I think, are really important in space that we continue to learn and grow in. There are times during negotiations when we receive contracts that are 1,000 pages and would sit 3 feet high on a desk, and just keeping track of the proposed revisions and version custody and control and things like that are ideal spaces in this. But I would say the largest pain point in our interaction is the denial space. There is obviously a continued emphasis across the insurance landscape, whether federal, state, or private, to control medical loss ratios and utilization by denying, delaying, or otherwise avoiding payment in some particular way. I understand that from their business model perspective, but from ours, of course, it's a big challenge. I think that any opportunity to leverage denial responsiveness, investigation, is critical. We are working in that space now with automated clinical appeals, which is important. Happy to talk a little bit about that. And then also we are working to develop technology to work on the technical side of appeals, which I would say is a combination of at least, and John will have to correct me, but the term that I think about it, it's more automated learning or machine learning, because we're looking for patterns of circumstances that occur and then using automation to correct those activities. This is where we can gain a great deal of efficiency. If you think about the normal office hours for a business office, for example, let's call it, I don't think anyone works 9 to 5, so we'll just call it 7 to 7. This is an opportunity to have technology working for you overnight, and just like we do in a number of different areas, to create efficiency and scalability. And I'd be happy to dive deeper into any of those if you'd like me to.
Really, yeah. Okay, we'll get to more of that in a minute. I just want to touch on something that we're all concerned with: patient privacy, patient data privacy. Data management is such a huge part of not only AI but any healthcare operation these days. And there are concerns. I mean, every day we see a new data breach somewhere, or downtime caused by an outage. Certainly, we're experiencing that now with AWS or thereabouts. So what's your approach to making sure that these AI solutions are secure and that patient PHI is protected? Let's start with John on this one.
Yeah, I think, as you mentioned, there's major cloud outage yesterday and also today. So, redundancy and disaster recovery sites, all of that's super important for making sure that when you need that functionality, it's available to you. On the privacy and security aspect, I think, we've learned that it's very important to have a governance framework around your data and using AI on top of that. I think that governance framework would include an oversight, AI oversight committee, routine audits. We've got alignment with our HIPAA, GDPR, and anything else that's coming out from a AI regulatory standpoint. So that's a big part of what we do. We do work on data that's both de-identified, and then we have certain cases where it's identified data for specific customers. So we spend a lot of time on ensuring data is cleansed before we do that model training, for example. So that security architecture piece of what we do, and marrying both the security and data privacy elements back in how we're doing software development and ensuring that our customers are comfortable with that, is really important part of this, because we do think there are certain areas where it just makes sense. Like we shouldn't be afraid to allow a vendor or a partner to work with certain data when they have the right controls around it, because it's providing benefit to the industry overall. So it will help patient outcomes, if we can operate on certain data, as long as it's de-identified, we're following all HIPAA regulation and all that. And then I think a big part is a lot of this is human in the loop workflows. So, we tend to utilize that technique to ensure that we're not doing anything risky. So, that's kind of like what I would say an adoption framework, making sure that we have human in the loop where necessary. Not only are we doing all the security controls at a very low level, encryption and all that, but just ensure that when we're solving for something, our rollout strategy is to ensure that we've got the most kind of auditable, friendly framework that we're rolling out, and not trying to do something that might cause an issue down the line. So I think that transparency is really important for us as a rollout mechanism for these use cases. And I think, everybody's happy with that. Being that long term, our solutions are going to get smarter and smarter and smarter. So, this is kind of where we are today, and we're just trying to be thoughtful about that for high risk workflows.
Nice. Okay. Yeah. Steve, are the safeguards different? Or is governance different now that AI is part of the equation?
Yeah, definitely. I mean, a lot of what John mentioned really resonates with us. I think about the Palisade research study where they sent shutdown commands to the AI systems that defied the command for their own self-preservation. So I think we're wise to proceed with some caution. For us, we do have a AI oversight committee that I sit on, and mostly we are really fortunate to have chief analytics officer and a CIO that are really well versed in these technology protection and a great information security team. For us, the foundation was on selecting the right AI architecture. I think it's tempting, but as solutions come forward, but in healthcare, we can't really leverage or sign on to what I'll call an agentic or AI solution that is pinging open source architecture. So overall, perhaps the cost footprint in healthcare could be, although I haven't specifically studied this, maybe a little higher than in other industries because of the protected health information. So for us, it's a lot about on-premise data sets for high sensitivity, trying to leverage cloud where we can because it's definitely scalable and flexible. But to John's point, it needs to be leveraged with a HIPAA compliant provider with sort of a resident server structure that has zero trust architecture and things like that to keep us protected. Really strong procedures for us on human in the loop, as well as on auditing the output and the connections. I won't get this right. John will probably have a much better statistic than I do, but I know that the volume of attempts to breach our firewalls and hack into our systems are just, immeasurable and happening of every second and of every day. And so we have to really be cautious to protect the information that we have, whether it's protected health information, or for us, because we also do a lot of research, you have to protect your intellectual property from espionage, frankly, both domestic and foreign, around the work that you're doing. So there's a lot that needs to happen in this space in order for us to be meeting our obligation, our fiduciary obligations, both to the patients and the communities we serve.
Yeah. It's a very sophisticated and challenging environment, and certainly a topic alone that we could talk about all day long.
Yeah. I just to jump in on something Steve said, because that was really helpful. The concept of this kind of this data we all work in is extremely valuable to the bad guys, let's say. And I think in general, there's this concept like what we're seeing even internally, and what all of our customers seem to be talking about, is everybody wants to go out and find they're hearing from every vendor doing something. And every vendor is doing something in AI, and they want to sell, an add-on or do something with it. So what happens is an individual business unit may reach out and try to do something with a particular vendor, maybe that's not even in the healthcare space or health tech space. And what you end up getting is this fragmented approach to point solutions. And it puts not only the data a little bit more at risk, but it also creates this weakest link attack strategy, where you're you're using a smaller vendor or a point solution vendor, that hasn't had the right security oversight or investment, by the way. We spend, 10% of our R&D budget is really on security, because we're in this space. So I think that's one thing to watch out for, is that not only is the solution meeting your functional needs, but also that it has security oversight. They're in the space, they know what they're doing. They're not just like some sort of workflow vendor trying to solve a problem in health tech or healthcare, because that's where the problems will be. So that's one thing we've been talking a lot about, is the benefit of kind of going with a vendor who's not only got the infrastructure and the data that's already been consolidated, but the use cases can continue to be extended and added on over time, versus like a point solution that might, come to you with one solution and you try to solve it, even though there's a lot of data flowing back and forth, and it creates a lot of risk. So I think that's a big area that customers ask us, like, should we go with a point solution versus kind of platform type play? And I would look at that and the security review thoughtfully before going off with somebody who doesn't have the experience in the space.
Yeah. A good point to make, especially in this environment, this economy. There are so many out there that see this opportunity to bring in solutions out of the box. You've got the Amazons, the Googles, the Apples coming in with healthcare solutions that they have good ideas, but they might not fit well into healthcare. And it's incumbent upon health systems to understand that the challenges of looking outside of healthcare for these solutions. Now, with AI, we've talked. You've talked a little bit, Steve, about different solutions that you're employing now. The idea of using ambient AI for not only capturing the doctor-patient, nurse-patient conversation, but possibly coding. What are some of these new AI tools that are coming along that you want to use, and you might be excited to give them a shot? I'm starting with you on this one, Steve.
Yeah, I think it's really exciting in the revenue cycle space that it's center stage today, and I think that's primarily because there is the ability to lean in as an agent for things that people do, and serve as a technologic adjunct to that work while maintaining some of the human in the loop. Essentially doing with automation what people have been doing today, and what is largely a volume of things that would require too many people to possibly manage in the environment that we operate in. So you gain speed, reduce errors, drive some efficiency, enabling you to shift the people that you do have to higher level tasks. It's really one of the reasons why cross finances has been so prevalent recently, in my opinion, is it's really an ideal early adopter target. So what would we like to try that we haven't? So the way I think about this is I think about the technology adoption curve, and it's so much steeper for AI than it was with anything else. I think if you compare it to the adoption curve for the iPhone, AI is much steeper and quicker. And so, in many ways, my view is this is sort of the next industrial revolution. It's just happening in technology, and we may not be calling it that. So a lot of what I think about that I would like to try or haven't implemented, I'm guessing I haven't seen yet. And I'm guessing that it hasn't come across my desk, because I could tell you that every one that has, I've been open to innovating, to understanding and considering how we implement it, if it's the right solution that provides the right value proposition for our mission. So one of those areas that I think would be some of the initial work that IBM tried to do with Big Blue, which is really tools that will enable quicker and faster disease identification or diagnosis, which I think will be technology that helps drive us to predict where we need authorizations, how we need to build clinical pathways, and how we then drive reimbursement by predicting the patterns and the things that will happen with the payers, as opposed to being reactive. So for me, I think of it in three different ways. One, shifting from inaction to action, shifting from ideation to execution and moving from sort of being clumsy to being nimble in this space by being a leader and not being afraid to implement these technologies. I try to tell the team who are excellent and are much better prepared to meet many of these obligations than I am with their experience is we need to take risks, and we will not succeed in every risk that we take. And that's part of innovation and leading in healthcare. And that's okay. Let's hope that they're $500,000 mistakes and not $500 million mistakes. But we're going to need to do that. Along those lines, I think we'll see a fair amount of vertical integration among companies in this space. If you're doing the ambient listening and the clinical decision documentation, you may as well be doing the coding. So at some point, I think we'll see some consolidation and vertical roll-up of these companies. As that happens, I'm excited to see some of the new technologies that come out and are made available. I would be willing to bet that just while we're having this conversation, something new has hit the street that I'm not aware of yet that will probably provide value and hopefully will land with us soon. So kind of a roundabout answer, but if it's out there and it provides value, I'd love to hear about it.
No, that's a very good answer. And I like how you've taken what could be considered a clinical use of AI in disease prediction and clinical decision support and apply the RCM lens to it. It's so important nowadays that so much of the sexy AI tools are the tools that are going to help patients, are going to improve clinical care and improve the doctor's workflow. And in order for that to move forward, you've got to think about this as an RCM angle. Do you see more opportunities to collaborate with your CMOs, with your clinicians, on tools that have dual ROI, that they have clinical improvements in mind, but they also are a benefit to RCM?
Yeah, great question. I think there's two areas that I see in that. And let me start by saying that I'm grateful for the strong collaboration that we have with our medical leaders, our chief clinical officers and our chief medical officers for certain, and many others across our system. I think a lot of people think of revenue cycle as being billing, even though it's the smallest piece of what happens in the revenue cycle. And so I think you have to take that step back and realize that whether it's through patient access and registration or clinical documentation improvement or utilization management and review in partnership with providers, which is part of revenue cycle, it's at the elbow and it's side by side. So if you're not talking to your physicians and you're not making them part of the decision, I think you are missing a big opportunity. One of those opportunities, I think, is going to be in utilization review and automating and predicting the work that occurs around determining the level of care, obtaining those authorizations for inpatient admission, two-midnight rule, fighting against observation, downgrades and things like that, and working across that continuum. That's where we really need the physicians at the table. And if there's any opportunity to reduce the number of clicks for our providers and enable them to continue to provide patient care and use their expertise in a way that isn't chained to the computer, I think that we gain both in the patient experience and in physician satisfaction. So all of those things are going to be driven through reimbursement. If I put my CFO hat back on, no margin, no mission. And if we're not able to produce positive contribution margin through these things, it will be difficult to meet that mission. So we've got to have the physicians at the table, our tech partners, and our revenue cycle leaders in order to drive the organization forward.
Very good. Yeah. Now, John, I'm going to turn that question around to you too. First of all, this one, where are the new advances in AI going? What are the new tools coming along? And also, is this giving you an opportunity to work more with the CMO, with the CIO, and kind of fold clinical innovation into this equation?
Yeah. I think Stephen provided an excellent answer with respect to the CMO and some interesting things on where we're seeing everything going. So I think there's not a whole lot to add there from that perspective, because pushing it, we like to say pushing it up into the front office, like before the front office or into care for a lot of this financial data. But I would just maybe add one thing. This data that we get on the back side of the care is really interesting encounters data. So we know that tracking efficacy of certain drugs from the pharma community and trying to link together patient visits with that data. I think there's going to be a lot of real advancement on that. I know I've been in previous experience in pharmacovigilance and understanding how to use this data so that you can get to causalities and understand what's going on and effectiveness of these drug treatments. I think there's a lot to come in the future on that side, which would be the inverse of what Steve was talking about, pushing it up. This is all going to get into one space where this data is going to be valuable, both from a financial perspective as medical care and patient. Being able to take that data and make it more portable, I think, is going to be a big focus the next couple of years. From AI tooling, we've talked about a lot of what's going on. I think Steve mentioned something I'll just call out, picking the right partners like that can solve, your problems and are innovating at the right speed, I think is a really key element. As a CTO of a software company, I think in general, there's a lot going on right now. There's a lot of trying to figure out what's marketing, what's real, what isn't. I think CIOs have a hard job right now trying to figure out, with all the different vendor approaches and what's going on. And I think for us, it's been about getting the right partners, that can scale and can innovate at the speed it's going to push yourself, to do more and more. And I think that's been a big part of what we've been doing, from our development team, making sure we have a right stack, the right vendors, they're doing things responsibly, but also partners that can innovate and are going to continue to grow, because what we see today is not going to be what we get in 12 months from now. The speed of innovation has, increased by an order of magnitude. And, to Steve's point, this is really probably the first unbelievable accelerant in technology innovation. I mean, I was lucky enough to start my career when the web was taking off, when Java was created, when all this was happening really fast. And I think that was a transition from traditional software to distributed web-based interfaces. But not so transitional from the perspective that we're seeing today with AI and the Gen AI tooling. What we're seeing from vendors being able to produce faster, these iteration cycles and innovation cycles are now rapid, and they're spread out, they're federated. So, it's not like we're waiting for some AI team to go off and figure out a model that works over 6 months. It's basically every engineer working at a software company is looking at some tooling that's helping them do their job more effectively, so that what we can release out, I think is better for the end consumer in the healthcare space. And I think in general, it's all going to be about the data and making sure we can use this data, cross-platform and cross-product and cross-use case, and making sure that we can continue to iterate there. That's really going to drive the great innovations of the next couple of years.
Yeah. Yeah. And what we're hearing is, the old traditional 5-year plan is out the window now. You don't look that far ahead. AI is advancing so rapidly. 3 years is even a tough sell. It's 1 year for these types of innovations.
Yeah, it's great.
Now, okay, we are at about 15 minutes left. We've had a great conversation. I do have one really good question that's come in so far that I want to get to, and I would encourage our audience again, if you want to ask a question, please submit one so we can add it into the routine here. What I want to do is go to this next question, because this had been touched upon earlier, and this is something I see as kind of something new. Well, not necessarily new for revenue cycle management, but something that you can get more involved in now because of AI. Steve, how has AI changed the interactions you've had with patients? How does this change the patient financial experience? And where do you see things heading in this particular area?
I lost the first part of your question. You were referring to the OB3?
Well, we had talked before a little bit, well, you mentioned before a little bit about the fact that AI can now be used to help so that RevCycle RCM can work with patients on their financial experience. You've got more data available, and AI is giving you that data at the point of care so that you can help patients. How do you see AI changing this patient financial experience, and where do you see this heading with RCM?
Yeah, thank you for restating that. I think that there are two pieces that I think of from that patient financial experience. One, we have to recognize that in as much as we might be able to use that technology for estimation, for advanced notification, for predicting patient liabilities, because a deductible, for example, that we think a patient has an obligation on, that could change if there's claims from other providers that haven't settled with the insurer yet, right? So we're trying to drive accuracy around that. But I think we would be remiss to not recognize that our consumers will also be using this technology to shop through price transparency, to compare quality ratings and provider information, and to learn ways of engaging with their providers around their patient liability. We already know that there's a little bit of that happens, if you will, around the water cooler or in chat rooms or in social media posts. If you get that bill from XYZ Hospital, just call them up and tell them you can't pay it and ask them for a 70% discount, and they might give it to you, right? So I think there's lots of ways that patients will be leveraging AI. Unfortunately, one of those will probably be in self-diagnosis and trying to figure out what's wrong with them based on their symptoms. So probably a challenge for the physicians. But I think that we will be hearing some of that with our front-end resources and folks that are engaging with patients. And we'll need to respond to that in some particular way. So that patient financial experience to me may be financial and how it helps revenue cycle, but we have to recognize that often that first person that a patient interacts with is a revenue cycle person, whether it's coming up to the ED, calling for an appointment, or showing up for an ambulatory test. And so we'll have to balance the sensitivities that are occurring around that.
Nice. Okay. John, same question. How will AI change the patient financial experience?
Well, I mean, I think we've touched on a lot of the items today, but I'd like to just say, hopefully we'll make it better, because today it's a terrible experience in a lot of cases, bouncing between, an insurance provider, through your work and, some sort of government supplemental insurance and a hospital system that's trying to, recoup as much revenue as possible because of the financial constraints. So I think that, what Stephen said is right on, and that we've got nothing but upside here, and using this ethically and targeting the ultimate thing, which would be the financial experience should benefit, all three parties, patient, payer, and provider. This interaction between all three should get better over time, and hopefully as a patient that would result in quicker time for care and better care and easier experience from a financial perspective, because I think that's what we're all in this for, is really patient outcomes, and that's what we're trying to get to with all the technology we're enabling with this. But there is, we talked about previously some of the advanced uses and linking together pharma, earlier in the process, and then I think your experience with your medical provider is going to improve and simplify the financial experience as well. So onward and upward in this perspective.
And that's an ideal place to kind of segue into the question that has been, or one of the questions that have been sent in. And I understand we have about 10 minutes left. It's interesting, and I can't wait for your viewpoint on this. To what extent do you foresee the OBBBA, the big beautiful bill that we've got? How is this providing additional areas of opportunity to deploy AI within front, mid, and back office operations? Steve, I want to start with you on this one.
Sure. OB3. I think for one, it exposed the fragility of a lot of outdated systems. But I think that the ideal test case is in the front end, to be specific to the question, which is the sweeping changes that OB3 implemented relative to Medicaid and to ACA programs. Remember, those things include semi-annual redeterminations, increased eligibility criteria, new cost-sharing rules, retroactive coverage limitations, so on and so forth. So I think this is an ideal space for technology to be implemented to help ease the burden administratively on providers to do some of these tasks in an automated fashion, to help with the work rules evidence, the redetermination and qualifications for Medicaid, and some of the other things that are going through the OBA, what I call the OB3. Lastly, I think that there is some funding legislation in OB3 to help build out data centers and to provide some incentives and support for what's going to be necessary in terms of infrastructure. I think that that's important to us because ultimately we're going to need to adopt these technologies, whether front, middle, back, in the most cost-effective manner. And there's a lot of capital going into AI, and someone's going to be looking to get that capital back. And health systems don't really have the financial resources facing with the headwinds that we're facing to be able to be that solution alone. So I think we're all facing some potential challenges there.
Nice. Okay, John, same question.
I was just going to turn it back to Steve because he's, in the seat. But what would your recommendation be to somebody who's kind of, running a hospital system in a different state and trying to understand where to go from here if they're still working with dated systems? What do you and your peers say about, like, what's number one, what's number two, like what should someone be thinking about?
Yeah, I mean, it's a great question. I mean, I think being a health system, you have an advantage because you have scale. I think independent standalone hospitals will face a greater challenge in this space as they work with more limited resources in many circumstances to satisfy all of the needs. So I think, at least from my perspective, we may see some increased affiliation, consolidation in the industry. Maybe there's an opportunity for independent entities to partner through associations or other groups to leverage some of this technology to gain some scale and increase the affordability and gain access. But mostly, I think it's reaching out to your vendor partners, reading, connecting at conferences, learning as much as you can about this. And as you become more educated, trying to contrast what you're learning with what you know to be the strategy of your organization and the operational challenges that you face. Whether that's, labor productivity, supply chain, analytics, or John, a really important thing that you mentioned that we didn't get into, which is, how these solutions can support pharma, whether retail or inpatient, where there's a lot of pressure from payers. So that would be my advice. Ask questions, be curious. The more you ask, the more you'll learn.
Yeah, I would love to ask you, as we go on, we've got about 8 minutes left, maybe a little bit less. Do you see AI as helping to improve your relationship with payers?
I mean, I could just jump in from the vendor perspective because we have a clearinghouse and we have clearinghouse, capabilities, and we work in it. I mean, in the clearinghouses, there's a large system. It's kind of a network of communication between payers and providers, and I mean, I think the way we see it is we're already detecting a lot of responses that are AI generated from the payers. So this is an interesting dilemma that's going to be, AI to AI speaking to each other, different generating, who's one step ahead of the other, and their models may be adjusted based on how, front office and how hospital systems are implementing different software to solve it. So we're kind of in this arms race, as it were. But I guess what you wouldn't want to do is kind of sit out. You wouldn't want to sit out and be like, oh, everybody's getting more and more intelligent systems, so I shouldn't do anything and just do it, manually. So I think, that's another thing I'd say is just important to, partner and invest in your solutions where it's going to continue to advance, because these quick innovation cycles, are on both sides. I think payers are doing it, and providers need to implement intelligent software and to be able to adapt. Right now we're in the early stages, but we can definitely see that the complexities are getting more and more intelligent, and the end result is that denials keep going up, and we're seeing that this is impacting everybody, all three legs of the stool. So we got to keep investing and trying to get smarter about this. One good thing is I'm originally from financial services, but one good thing I'm seeing is that, with some of the standards on it, and healthcare has been a real file-based system, which makes everything complicated, slow, batch-oriented. But I think lately, because of the needs of AI and intelligent workflow, I think we're seeing more emphasis on, FHIR, TEFCA, and certain areas, and these standards for real-time interaction. I'd love to see kind of what we used to say straight through processing in the financial services world. Like, how can we settle this like as quickly as possible rather than delaying it, and get to more open API and standards such that it's not this kind of like guessing game and requires so much horsepower to actually figure out every single payer contract and relationship and file-based interaction, which all slows down the system, and I think it makes it more complex. And I understand that might be part of the game here, but I think AI is going to help simplify interactions through standardization, better APIs, and more real-time interactions over time. It always helps to have the government step in and help you with that, but let's see where it goes from here.
Yeah. There's certain bot versus bot mentality going on here, that you have to embrace AI because the payers are embracing AI, and you got to keep up with them. But Steve, same question: can you use AI to improve relationships with payers?
Yeah, I would like to think the answer is yes. Right? There's a little bit of this bot versus bot. I love it. It's kind of the Clone Wars. For the Star Wars fans out there, I think that's kind of true. Healthcare costs are inelastic. We're not going to be able to go back to the cost footprint we had pre-COVID. You can't put the genie back in the bottle, if you will. And so I think the technology should help. But going back to something that John said, I think this is about contract performance. We tend in our managed care negotiations to spend a lot of time on rate, but it's really about yield. And if our contracts are not yielding what we negotiated with our payers, there has to be a consequence to that. And so I think the first place in that conversation will be using much deeper analytics to identify areas where there is meaningful erosion of contracted yield in services, whether that's through technology, or other policy changes, and really a strong need to engage with the payers collaboratively in a discussion around why, the contract isn't yielding what was intended. So to the extent that the payers would be receptive to those conversations, yes, I think that the technology can help improve relations. I'm a little fearful in the near term that the technology will highlight areas where we have revenue leakage and maybe create some tension in those relations before we move toward, a more improved and equal footing in terms of the understanding. Historically, I think their data has been better than ours, so hopefully we'll catch up.
Yeah, nice. Okay, we've just about hit the top of the hour. I think this was a fantastic discussion. I want to thank the two of you for joining me today in this discussion. And that's all the time we have for questions today. In closing, please note that our next Winning Edge program on November 11th, it's a couple weeks away, I believe, will cover the Winning Edge for Nursing Change Management. A live clickable link will appear at the close of this program, taking you to our registration page for that event. Remember to follow along all week for continued coverage. I will have a story, a summary of this conversation tomorrow at some point, and we will also have the YouTube video of this event on Friday for continued coverage on AI's role in modernizing revenue cycle management. And you can find all these at our website, healthleadersmedia.com. I want to thank our panelists again for an excellent discussion, and our sponsor, FinThrive, for making this program possible. And finally, thank you to those in our audience for participating. We hope you enjoyed today's program and look forward to seeing you during our next Winning Edge program and other Health Leaders events. Thank you very much.